So I'm here today with Dr. Kim Jobst, who is an integrative health specialist and a consultant physician. So welcome to Suburban Sandcastles, Kim, and thanks for being on a call with me today. You studied medicine at Oxford University and then went on to train in homeopathy, Jungian analytics, and also traditional Chinese acupuncture. So you clearly have a really strong interest in integrative health. What does it mean to you to treat the person rather than just the disease, which seems to be the more orthodox approach to medicine?
Such a great question, and it's really, really lovely to be here with you and to see you again. Well, right from the very beginning, I never saw the disease as separate from the person. After all, it's the person who ostensibly has the disease. So it never made sense to me. It just never made sense right from the very, very beginning that they would be separated. Even when I was a child. And, it was as a child that I was exposed to other healing modalities. I was exposed to homeopathy, and I was exposed to Chinese and Oriental medicine and to different other forms of healing. So they were in and around my environment. And I suppose in that environment, it's a really great question. I haven't been asked that question. I just never saw them as separate. I was just interested in the whole person.
So being in medicine and traditional medicine, very much looking at the way a disease behaves, not necessarily how it behaves in a person. How did that work for you when you're studying and applying these kinds of approaches to treatments and projecting, the way a disease might behave in a person? How were you able to take that kind of model and apply it to the person?
Okay, so I think the first thing for me to say is that I did not want to study medicine. I really didn't. When I finished school, I had it with school, I had it with exams, and I wanted to go to agricultural college, and I wanted to work with my father breeding bulls and doing stuff on the land. And I just didn't have a choice. And it wasn't from any external agency. All I can say to you is that God spoke to me. It was like, it was so powerful and so unmistakable and so clear that if I wanted to understand life and people, which is what I wanted, then I had to do medicine. And so began a journey that brings me to being here. So I didn't go into medicine because I wanted to be a doctor per se. I went into medicine because I really wanted to understand life and people. I wanted to understand how it all works, and I wanted to understand why people get sick and what healing was really about. So, and on that journey, even from being a small child, my early experiences opened me up to seeing things in a different way. So by the time that inner certainty occurred, and I was 18 at that time, 17, 18, I'd already done a lot of thinking and reading and had a lot of experiences and seen a lot of sick people get well and other people die, and most notably my grandmother die, which was an incredibly powerful experience for me, and actually experience how the death is not the end. Being by her, with her, in her room as she breathed her last breath, I had absolute certainty that of my experience that the body was left behind, but something else had gone. So I went into it with that background, and I went into it to understand as much as I possibly could. And I had always at the back of my mind, okay, so this is how much we know if we look at physiology, we look at anatomy, and we can go down into the molecular biology. But there's always another question. How does a molecule work? Where does the molecule come from? And then we go into a molecule and we go into the particles. Well, where does the particle come from? And what is the particle made of? and that goes into another particle and another, and it just never stopped. So for me, the conventional model, so-called conventional model, was just one of the stepping stones along the way. First. The second thing was that because of my early experiences with energy and homeopathy and acupuncture, and especially Oriental medicine and Oriental medicine diagnosis using the face and the tongue and the pulse, which I had experienced because I'd been ill myself, I went in secret to study acupuncture and Chinese medicine while I was a medical student. And at the time, it was still on the statutes that if the words were fraternizing with practitioners of fringe medicine, it was then still called fringe medicine, would have you removed from the medical school. So I used to go off in secret to work at an acupuncture clinic and to learn and to study. And so I learned, 5-element theory, and I learned about the cycles, and I learned to take pulses. So I would bring that to what I was learning, always. I would start to try to see when we were talking about heart disease, I would also try to explain it within the context of the Chinese medical framework. And I actually wrote about it at one point, and it was published in the Journal of Alternative and Complementary Medicine. Because actually there is a remarkable synergy. And there were many times when the Chinese system would make me look at the kidneys or look at the lungs or look at the liver where we hadn't already done so in the hospital, and sure enough, there we would find the issue. So I was being able to validate the whole thing.
Wow.
In a different...
What a unique perspective.
Sorry?
What a unique perspective to be applying that at the same time as you're learning. And potentially going to go under the radar a bit.
Oh, yeah.
Yeah.
Yeah, no, I had to go. And what's interesting is that, so this is 1981 to 1984, 85, when I was at St Thomas's Hospital in London, after Oxford. Now they have a department of acupuncture.
Wow.
It's really interesting.
Yeah. And it is interesting for us in Australia to be looking at that, because where there seems to be a lot of pulling apart of natural medicine, the other side of the world, there is still that strength in it. So I guess if you're looking at everything being conserved and in balance, it's there. But certainly here in Australia, we're facing a lot of opposition to a lot of alternative medicine. So particularly homeopathy is an area that you did study, and that has been around for 200 years. There's claims that around 200 million people use homeopathy, and yet in the mainstream it's considered quackery and it can't be proven and it's unscientific and all of this kind of thing. What do you think is in the way of it being accepted as a legitimate modality by the mainstream?
Really simple. Human consciousness. I mean, really simple, really huge.
I love that you've said that. Elaborate.
It's really interesting when germ theory was, there's an apocryphal story that is told, which I remember early on in my own training. When germ theory was first brought out, the story goes that the royal surgeon in London was told about the importance of cleansing the knives and the instruments and the hands in order to minimize disease. And it is said that he took the knife with which he was going to make his first incision, and he said, "This is what I think about germ theory." And he ran it down the sole of his boot that he had walked through the muddy streets of London in, and made his first incision.
Wow.
Now, today, in the era of antibiotics and all the problems that has given rise to, where germs are part of our consciousness and our thinking, and there's no problem with them, even though we can't really see them. And now there's this whole question about whether measles is actually an infectious disease. Of course, it's completely, obvious. And there are germs, and germs breed infection, and infection needs to be treated. I believe, I don't know that it'll happen in my lifetime, I think it might, that our understanding of energy and how it is, how it works and how it is transferable, is going to develop in such extraordinary ways that there will be a scientific underpinning. But it doesn't mean that the explanation for homeopathy actually lies within the current mindset, molecular biological mindset. I think that the real understanding of homeopathy and other healing modalities lies in a very different understanding of how energy works. It's much deeper and it's much more complex.
There's been some literature around the idea that until science or reductionist science considers God, there'll never be full evolution in terms of our ideas and understanding of healing and medicine and indeed consciousness, because they can't be separated. But there's a huge resistance in the scientific community to acknowledging it at all. Is that what you're saying here around our thinking with homeopathy too? That we need to evolve our consciousness in order to see how that actually does have an interplay with our own biology?
Absolutely. But it's interesting. This is huge because different people have different understandings of God. And I want to move through and beyond any constraint the constraint that occurs if we get stuck within a religious framework.
Yeah.
The religious framework is a construct of mind. God exists within those constructs of mind in all the great traditions. And just like love can't be destroyed, it's there independent of whatever it is that happens to and in us and in our lives. God is the same, indestructible. So whether we come from a Hindu or a Christian or a Muslim or whatever background, it doesn't really matter. God is God. Now, we can think about it and personalize it, and we can also, and I think this is extremely important, a teacher that we both love and respect so much talks about the grand organizing design. At school, I used to write God equals generator of diversity. There is a force. Now, what I understand and what I would seek to communicate to people is that the real distinction between the healer and the mechanic in medicine, and I'm going to medicine as a whole, in which embraces so many different areas of work and healing, and I'm going to have healing right there in the middle of what medicine is really about. The distinction between a mechanic and a healer is that a healer surrenders to something they are conscious that they don't know and understand. So healing is about this miraculous process that happens in an individual. We have an incomplete understanding of the framework of what constitutes an individual, right down to the particles, the molecules, or we can come back up. But what is indubitable, and to me it's always been so strange in talking with colleagues who get angry about it, is that we don't know where it comes from, and we don't know how it works. Now, so if you mean that the full understanding of the healing modalities is not going to happen until we can acknowledge that, then I agree with you completely.
Yeah, that was what I was trying to get to with that, because there seems to be a ceiling that science continues to hit without acknowledging that piece. And until we do, I wonder how much we can, evolve our understanding of so many things.
Well, it's relentless, because the interesting thing is that, I think this is all about ego at the end of the day. The great scientist, the true scientist, is the scientist who stands in awe, who appreciates that we have this thing, this brain, and we have our intellectual faculties, and we do the best that we can to try to understand things, but actually we are lived by and motivated by something else. You look at Einstein and you look at Newton and all of these great people. They had this deep, deep respect for and understanding that life is way bigger than they are. It doesn't stop us, and it shouldn't stop us. But in my experience, the great physicians and the great surgeons that I have known, and I've known some great physicians and surgeons, they all say the same thing. They have this thing called intuition. You learn your anatomy, you learn your physiology, you learn the diagnostic pathways, you learn the differential diagnosis, you learn your pharmacology and all the rest of the stuff. You walk into a consult, or the patient walks in, you have an intuition. What is that? And there are times that will take you off in a direction you would not have thought about at the beginning. Now, if we talk about homeopathy, and why did I study homeopathy? I studied homeopathy because I had seen extraordinary things happen, the first of which was with my mother when I was a very small child. And I experienced the conventional doctor standing at the end of her bed saying to her, "Mrs. Jobst, you are a very stupid woman. You realize that you may leave your children without a mother," because she was refusing what at that time was antibiotic treatment. And then the homeopath come, who was also a GP, interestingly, at that time. So we're talking about 1963-4, and giving her this little pill and literally watching her over the space of 36 hours recover. Just her life come back. And I've got goose pimples as I'm talking to you. It was a really extraordinary experience. So that was my first exposure to it. And then I had my own experience when I was a junior doctor. I was actually doing my surgical job in Cornwall, and I got a bilateral pneumonitis. It was a very stressful time emotionally. For me personally, it was a very stressful time in my job. And my boss was a wonderful surgeon, one of those great surgeons I will talk about. And he said, "I think you need some time off. I think you need to come in and you need antibiotics intravenously." And I said, "I don't want to do that. I just had this." And I went to see a man called George Fidulkas, who agreed to see me in London if I would be a teaching case. And he gave me a remedy. I will, as long as I live, I will never forget the impact of taking that remedy. Within minutes, literally within minutes, I never lost a day off work. It was it's a whole story in itself. So these are two very powerful personal experiences. And then I thought, if this is placebo, because I was already qualified as a physician, if this is placebo, then all I want to study is placebo. And in a way, that's kind of what I've done. So my interest in homeopathy is that because of the way in which one is helped to approach the problem, it helps to keep the mind open. And you'll find most of the doctors who study homeopathy, they do it because they are desperate to be able to connect and to relate, and not to just be sitting behind a desk writing prescriptions. It needs a different relationship. And then you enter into a very deep discussion, because is the result just the consequence of a deeper relationship and a more complex way of taking a history? we can discuss that for a long time.
Because of that relationship between the humanity involved in the relationship with the physician in that way.
Absolutely.
Yeah.
But there are times, like my mother's experience, my experience of treating my own children. I went up to Scotland. I worked in the homeopathic hospital. I worked with some really great homeopaths, people who've done fantastic research, like David Riley and Tom Whitmarsh. These are giants of our time. I experienced it. I saw it. I learned. I found my own way. So there are times when I see homeopathy work, I don't actually care about a mechanism, because actually all I care about is that the patient recovers, gets better, and that takes us into the whole question of disease. But there are certain times when the pill and the response are just so causally related. It's so apparent. There are other times when I think it's about the relationship. And even the pill and the response being what one would say causally related in time, I think that's also the relationship. Because it's about meaning.
The science of meaning underpins a lot of what you do now. And you've published and co-authored over 150 different scientific papers and books. And you've also been a founding member of a council with His Royal Highness Prince Charles. The royal family particularly are a long time advocates and users of homeopathy. So what's the thrust of your work now, and how do you see meaning and disease so intricately linked?
Okay. The way it goes now, and the banner under which I wish to work going forwards, is that meanings matter. The science of meaning underpins everything. The beginning of the Bible, it opens with, "In the beginning was the Word, and the Word was God, and the Word was with God." The power of sound, and the power of the meaning of that sound is so profound. In fact, from what I understand, and I'm not properly informed yet, some of the cutting edge physicists now are actually saying that it would appear that the universe was born from sound rather than light. Now that is really interesting to me. I need to know a lot more about it, but I remember particularly recently, and also discussing it with Dr. DiMartini, that this is very, very significant. Now, in my work as a physician and as a healer now, it has become clear, and it's every day it's deeper, that everything that happens in our life happens in a way that has meaning, that is unique to the person. That's the key thing. You and I could both have asthma, but its meaning to you and to me will be different and unique. And what has become clear in my work is that when we understand that, we get to understand that it has a purpose. And when we understand that and we understand its purpose, we can address that, and very often the symptoms will disappear. It doesn't mean we may not need to treat it, but its course will be different. Now, just to go all the way very fast, it has also become evident to me that every single human being has a mission and purpose, a purpose that is unique to them. And when we can, and for many, many people that's not clear, they don't know what it is. They feel it, but they don't know what it is. And so I work now with people to get clear on what that is, using a very simple process which you and I have done together, And when that becomes clear, then you see that every symptom, every challenge, every decision, everything that's happening in your life is existing and happening in your life in order for you to be able to fulfill that. And I call that the telos now. The end in mind, the reason we're here. Now, what I have found in my practice, and I have a small practice that goes very deep, is that when people take the time and are willing to do that work, for that to become clear, their entire trajectory changes. And for the most part, they come off medications. They undergo sometimes quite challenging transformations. But health and vitality changes substantially. Does that make sense?
It does, yeah. Thank you for sharing that, because I think in this mainstream model around illness and health and those being two sort of polar opposite things, and that illness should be something you should run away from and that doesn't really have any wisdom within it, this brings a lot more light to seeing the messages in that and the feedback and the purpose of understanding symptoms as opposed to perhaps trying to eradicate them, which seems to be more of the Western approach to health, and perhaps why there is this disjoint between alternative medicines and the Western approach, which we're really seeking to, I guess, how do we help them to work more effectively alongside each other? And I think that depends a lot, obviously, on the physician and the school of thought behind each of those systems, because obviously you're working across both and you have the understanding of both, but there's obviously going to be people who aren't willing to have that on either side of the camp. And so we really want to, I guess, open up the conversation around how they can assist each other, ultimately, and help an individual form a health team.
Yeah, that's absolutely true. I have said often in the course of now over 30 years of experience is that one cannot underestimate just how threatening and challenging it is if what you have dedicated hundreds, if not thousands of hours to studying and practicing is called into question by something that appears to be, foofy-doof in some way, or comes from a different tradition. If one's identity is tied up in a particular way of doing something rather than in the outcome, which is I want the healing for my patient, then what is brought, whether it's a naturopath, a homeopath, an acupuncturist, a Reiki master, or whatever, it's an attack on your identity. And then it's polarized. And I could not be more vociferous about how useless that polarization is. I mean, it's only useless. And even that is a statement that one needs to examine, because the polarization occurs and reflects the level of consciousness of the individuals involved. That's why we can come back to the beginning of our conversation. What is it going to take? It's going to take a change in consciousness. When you understand that, yes, there is surgery and there's everything that can come from that amazing advance in technology and the way of seeing the body as a molecular and physical structure in the way that we do. And then there's the other, which is that every human being is a spiritual entity that has experience and that has meaning for them, for me, the spirituality is about meaning. It's not about some religious structure. It's about what gives life meaning. So it may be a religious structure that gives life meaning. It may be football that gives life meaning. These two things coexist, and then they cannot exist without each other. And it takes great skill and very deep understanding and enormous courage sometimes, I have to say, to stand in the middle
Mm. I really admire that you've said that, because it's true, isn't it? The emotion that must be involved, as on either side of the camp, if you are not willing to somehow try to meet in the middle, must be overwhelming at times, and also incredibly would colour your view of things and colour your ability sometimes to even show up, in the way that you need to.
Oh my God. How one wants to hide.
Mm.
It's and there are very, very important socio-political issues at stake. Why would a nation like Australia, that has great scientists and great physicians and great artists, be demonizing natural medicine? It's inconceivable to me, because there was a time when Australia was on the verge of opening up and leading the way with some, great universities, courses, and research. And one realizes that this polarization, it has to implode at some point.
Mm. At some
Because
point,
you can't stop the river.
Well, the pendulum has to come back again, doesn't it? It can't continue that trajectory.
Yeah.
But I wonder what's it going to take? Is the question.
Well, in 10, 15, 20 years ago, more, and the birth of the holistic movement in Britain and in Europe, and what began to make the biggest impact was the financial consequence of the pharmaceutical approach that we were taking, that we just can't afford it. And I think that's what's going to break the system in the United States. Healthcare, if somebody found a solution to healthcare expenditure in the United States, it would quite literally save the United States economy. Quite literally. In fact, in Obama's time, he actually put out a call for that. And I'm involved with a group of people in the United States we've been working for the last 9 years with a program that could offer that without that being some kind of alternative. It's actually about looking at what works. It's really simple. What works? We've become wedded to a system and a mechanism that rewards activity, not what works.
Yeah.
And of course there's resistance to changing that by those who are involved. And what we find all over the world is that the people who are involved in sustaining it are also involved in deriving benefit from it. This is not an independent thing.
It's very hard to unmuddy the water.
So you were just talking to me, before we began, about the review of homeopathy and the revelation that the chair of the committee was a member of a group that have publicly declared their antipathy to homeopathy. And it's sad. It's very, very sad. And I can also tell you another story. This is true. When I was a junior doctor in Oxford, of course, every week we used to have these grand rounds in the hospital where a complex case would be discussed, and all the great physicians would come, and the junior doctors would have to do their thing. And it was an event. It was a great big piece of theatre, but great learning. And the Nuffield Professor of Medicine at the time was a guy called Sir David Weatherall, who is one of the greatest physicians and scientists of our time. And I found myself in the lift with him, going to the grand round, and he said to me, "How's your work in homeopathy going?" And I was surprised that he even knew anything about it. And I said, we had a conversation, and I said to him, "Well, what are your thoughts about it?" And he was very considered, and he said, "Well, I don't have a problem," he said, "because I'm interested in what works for people. But," he said, "what I can't understand is why people don't look at the science. We know that when solutions become more and more dilute, the molecules behave differently. So the actual behavior of the molecule changes at the infinitesimal dose. So he said, what we find is that they actually clump together. So maybe we just need to look at the behavior of matter at infinitesimal dilution. And our lift trip ended, and he walked out, and I walked out, and I've carried that with me all my life.
Wow.
A very great molecular scientist.
Wow. Whereas most people go, oh, dilution, that means it's ineffective. Like, not thinking about how that would, in fact, be effective by virtue of it being diluted, because it's in, the molecules behave differently.
Absolutely.
Dr. Kim, I feel like we could keep going for ages. There's just so much wisdom and insight that you're giving us, and so I really want to thank you for your time. And I'm sure that those watching are going to get so much insight and probably have just as many questions after they've watched this as they went into it. But yeah, thank you very much, and it's been wonderful to talk to you today.
Well, it's a real privilege. There was one thing I wanted to say to you, actually. I don't know why I didn't say anything about it. The thing that is extraordinary, that opens this whole thing up to, is that the consult doesn't necessarily have to be done face to face. This works over Skype. This thing of what we call consciousness, there's the next big frontier, and the great thing is that we can use it, and you and I have already experienced that. So thank you for that opportunity, and who knows where we go again.
Yeah, thank you.
Bless you. Thanks.